Pinellas Park Community Analysis by Katie Adams, Brianna Hernandez, and Ray York. Community Origins and Evolution. The area now called Pinellas Park was originally established to produce sugarcane in 1909. The area was chosen because of its proximity to the already established city of St. Petersburg and its desirable climate. In 1912, the area was inhabited by about 50 families and established its volunteer fire department consisting of 16 men. In only 1 year, the town would have a population of 250 people and its own town marshal. Pinellas Park is now celebrating its 100th year of being established as of 2015. As of 2012, Pinellas Park had a population of 49,686 people. Community structure. The City of Pinellas Park meets the needs of its citizens very well. Transportation issues are handled adequately by the Pinellas County Public Transportation Authority, PCTA, a station, and an international airport located a short distance away. Deserts located in Pinellas Park, which has several large grocery stores, including a Sam's Club and a Walmart. Recreational needs: the abundance of parks, recreational centers, walking trails, sports fields, and equestrian trails. Pinellas Park compares quite nicely with the surrounding communities, which also contain many of the same resources. However, Pinellas Park provides them in greater and with better accessibility. Issues with community structure. While conducting our windshield survey, we observed there were many major roads without bike lanes. This poses a health threat and may lead directly to the high number of vehicular-related fatalities.
Population analysis and health concerns. Based on the community findings of Pinellas Park, an issue that we identified is the fact that African Americans only make up 3.9% of the population versus the Caucasian population making up 74%. The state average for African Americans is 16.7%. A health concern for our community and similar surrounding communities is the issue of obesity. Obesity accounts for 9% of all medical spending. People who are suffering from obesity spend 41% more on their health care than average weight peers. As stated in the journal article on obesity rates on school-aged children, obesity rates are trending upward in all races and socioeconomic classes. Obesity and diabetes are the only medical conditions that are trending upward in Pinellas Park, surrounding communities, and nationwide. Health-related resources. For the population of 49,686, there are no hospitals located within the city limits. The most accessible hospital is Northside Hospital, located just outside the city limits in St. Petersburg. The hospital contains 225 beds, which in the case of a disaster would leave the community vulnerable and without treatment. The higher than average rate of unemployment in Pinellas Park leaves many citizens without insurance, which compromises access and affordability. Failure to have insurance or the means of payment reduces the acceptability in the community to get health care. Environmental analysis. In Pinellas Park, all environmental resources are adequate to meet community needs. This is evident by air quality index rated at 83.2%, which is above the U.S. average of 74.2%. The drinking water meets or exceeds the state and federal standards for water quality. Sewage and solid waste removal is adequate. This is evident by the lack of refuse buildup in front of homes and businesses. However, community members expressed a concern of increased vehicle emissions due to the overall increase in population. Government and public policy. Pinellas Park is a small, well-ran municipality whose budget is adequate to meet the community needs. Public officials are easily accessible through community meetings. However, those meetings are not well attended. The main area of economic concern is the unemployment rate, which has been steadily increasing over the years. 6 community needs. The first community need is diabetes. The county-wide percentage of people with diabetes is 9%, which can be directly associated with obesity rates of 26.3%. This is a problem for the community due to increased costs of care, poor treatment, compliance, and lack of access. The second issue is vehicular-related fatal accidents, including pedestrians, motor vehicle accidents, drunk driver accidents, etc. Pinellas Park averages 20.4 deaths per 100,000 versus the Florida average of 9.4 per 100,000. The third issue is crime rates are higher in Pinellas Park. The Florida average of crime per 100,000 people is 257, whereas in Pinellas Park that number rises to 396 per 100,000 people. A possible contributor to the increased crime rate is the officer to population ratio. Pinellas Park has only 2.03 officers per 1,000 people, while the Florida average is 2.4 officers per 1,000. The fourth issue is high unemployment rates in Pinellas Park. The unemployment rate in Pinellas Park is 8.9%. Pinellas Park was ranked number 41 on the list of cities in Florida with top unemployment growth rates. The fifth issue is lack of education. Currently, only 84% of high school students make it to graduation, and only 19% of those graduates go on to receive their bachelor's degree. This contributes to increased unemployment and proliferation of low-paying jobs. The sixth issue is natural disasters. This is a potential threat to Pinellas Park due to the fact that up to 15% of all housing consists of mobile homes. Historically, Pinellas Park is 33% more likely to experience a tornado than the national average. We place these issues in this order due to the impact on our quality of life and the overall impact on the community. Summary of community issues. Diabetes is not only a local issue to Pinellas Park, but it is a global issue. The diabetes rate of Pinellas County is 9% of the population. Globally, the rate of diabetes is 8%. In countries such as France, where the rate of diabetes is 6%, it is still the number one chronic illness. The major difference in the way the illness is being dealt with in France versus Pinellas County is that the cost of treatment is covered by the public health system in France, whereas it is not in Pinellas County. This leads to better adherence to diabetic treatment and less complications overall from the disease. Systematic changes are necessary in both Pinellas Park and France. Education is the primary prevention method for avoiding diabetes. A community health nurse would lead the way in educating the community.